Good afternoon, everyone. At this time, I'd like to turn the meeting over to Health Director Gibby Harris. Gibby.
Thank you, Bill. Good afternoon, everyone. Thank you for joining us this afternoon. I have with me Dr. Meg Sullivan. We have brief statements for you, and then we'll be happy to open up for questions. So a couple of quick things from me. We continue to watch our metrics as we do all the time. And what we are seeing is fairly consistent with what we were seeing last week, is most of our metrics are seeing slight upticks. We're seeing increases in our average cases per day of a small amount. We're seeing increases in our positivity rate. We're back up to 6.5%, unfortunately. Our case rate is up to 132.8 per 100,000. The good news on this is that our daily hospital rates have continued to decline slowly, and our outbreaks and clusters are at a much reduced level. We're down to 14 right now. So all of those numbers are good. So we continue to watch these numbers as we work to get as many people vaccinated as possible and as things reopen in our community. So we have about 17% of our population that are partially vaccinated at this point. Close to 11% are fully vaccinated. That's great news, but obviously that's nowhere near what we've been talking about when we talk about herd immunity, so we've got a ways to go there. In addition to that, the governor announced the opening of Group 4 on March 31st. That includes other congregate settings and all of those essential workers who were not eligible at the first half of Group 4. And then on April 7th, it's being opened up to everyone. So all citizens above the age of 16 will be eligible for a vaccine. So that's great news. I just want to caution people that we will need to continue to ask for patience. We are getting larger amounts of vaccine into the community, but there's not going to be enough that very first week that you're eligible for everybody to get vaccine. So just the patience is what we ask for. With our governor's executive order, we're also seeing increases in openings in our community. The governor made sure that we looked at these openings from a low risk, high risk, medium risk situation, and they made the percent capacities available based on those risks. So what I would recommend to our community as they are thinking about these continued openings in our community, that they need to be smart about this. Everybody is anxious to get out. Everybody wants to be out in the community, but we need to make sure that we're continuing to be safe, because we don't have enough people vaccinated and we still have high levels of virus in our community. The other issues that we're dealing with obviously are the variants as well, and we're watching those closely. So as you go out into the community, continue to watch where you're going. Be aware of your surroundings. If there are a lot of people packed into small spaces, that's not a good place for you to be. If there are a lot of people without wearing masks, that's not a good place for you to be. You can think about going back later or find some other place to visit. So we just really want to encourage people to continue to be smart and to use good common sense. Two really strong points that I will make. The mask mandate is still in effect. We are getting information about some businesses no longer requiring masks. That is inappropriate. The governor's order continues to have a mask mandate in it. Anytime you go out of your house, you should have a mask on. The second part is the social distancing piece, and this has confused people a little bit because of the CDC guidance and the state guidance around schools. So our schools are allowed to have social distancing for students of 3 feet. It allows for more children in the classroom, and the studies have been shown that there's not an increased risk of transmission among children if they're that close together. But the mandate around social distancing for everybody else continues to be 6 feet. So we need the community to make sure that they're wearing their masks and continuing to social distance by 6 feet when you're outside of your home. So with that, I will stop and turn it over to Dr. Sullivan.
Thank you, Gibby, and good afternoon, everyone. So I'm going to again provide a brief update for vaccines or about vaccines for Mecklenburg County Public Health. So as of yesterday, we had administered almost 69,000 doses of the COVID vaccine, including almost 43,000 first doses and 26,000 second doses. As Gibby mentioned, we know that vaccine supply continues to be limited in comparison to the demand we are seeing for appointments, but are optimistic that more and more vaccine will be available in the county in the coming weeks and months. And as we receive vaccine, we continue to be able to work to provide additional appointment opportunities at both our fixed site locations at Bojangles and Medic, as well as through our community vaccination efforts. Our hotline staff have been working tirelessly to answer calls, help individuals schedule appointments when available, and troubleshoot questions and challenges regarding vaccination appointments and provide accurate information about the 3 safe, effective vaccines that are currently available. We are currently focused on making appointments for individuals on the wait list and prioritize populations in accordance with our vaccine equity plan. And we expect to provide additional information next week about additional information or additional available appointments in April. And we'll continue to work to make as many appointments available to the public as supply allows, while still working to prioritize those at highest risk of impact from COVID-19. Highlights from our recent and upcoming events include partnering with Johnson & Wales and CPCC for vaccine events, hosting vaccine events at multiple church locations, working with local businesses to hold vaccine events on their sites, and working with our shelter and jail staff on finalizing the details of providing vaccinations at those sites in the coming weeks. We know our immunization team has been working long hours, 6 to 7 days a week, to plan and hold as many vaccination events as possible based on the supply we receive. And as always, we continue to work with our community partners and our vaccine event request list to plan future community events in multiple locations, aimed to assist with equitable distribution of the vaccine, again, with a particular focus on addressing racial disparities and serving those communities who have been disproportionately impacted by COVID. And finally, as we have mentioned, we also continue to spend significant time conducting outreach to the growing list of enrolled vaccine providers in the community, and to ensure access to the vaccine throughout the community. This week, we were excited to see that many of our enrolled providers in the county received direct allocation of the vaccine from the North Carolina Department of Health and Human Services. And so we continue to work to provide support for all of our enrolled providers, including transferring vaccine to various clinics and pharmacies throughout the county, again, to ensure as much access as possible. Thank you.
Thank you, Dr. Sullivan. First question today is Alison Kuznitz, Charlotte Observer.
Hey, Gibby, it's Alison Kuznitz from the Charlotte Observer. Could you drill into our trends a little more specifically over the past 2 weeks? What has really contributed to our rise from about 4.6% positivity rate to 6.5%? What factors are really causing that? And can you talk about then what the subsequent risk is to go out into the community, say an unvaccinated person going to a brewery this weekend versus a vaccinated person being exposed to the virus right now?
Gibby, you're muted.
Thank you, Meg. So, Alison, thank you for the questions. As I've mentioned, over the last 2 weeks, we have seen some upward trend in our cases and in our positivity rate. That is a little troubling, and I think part of that is related to the warmer weather we've had. People are getting out more, they're going to restaurants, they're going to bars, they're going to breweries, and are just out and about more than they had been being. So we are not terribly surprised by that. But the other issue, the other thing is that we had been seeing a fairly substantial decline in our numbers over about a month and a half. And so it was not, it's not a huge concern for us to see a little bit of an uptick. We're watching it very carefully. And there could be other reasons for that. We do know that we have variants in our community that are starting to spread. So that could be contributing to it as well. And then we do know that our children are back in school, which means parents are back at work, out and about more. Teachers are out and about more. So there are a number of different things that could have contributed to that. There's never just one thing that we can point to with those sorts of issues. Obviously, people who are fully vaccinated are safer going out into the community. That's just the bottom line. If you're fully vaccinated, you have less to worry about. That doesn't mean that you can't become infected. And there are studies starting to happen at the federal level to really look at the percentage of individuals who may become infected after being fully vaccinated. So it's going to be a while before we have the results of those studies. But what we do know is that the vaccine does work. It is effective. And so, again, just another reason for people to be encouraged to be vaccinated so that they can be safer when they do go out into the community.
Next question is Vanessa Rufus, WCNC.
Good afternoon, everyone, and happy Friday. I wanted to ask about the concept of herd immunity. I know we talked about it a lot over these past several months about essentially it being a goal and why we're doing all of these vaccinations. But I am starting to see growing statements from doctors out there who think that it's actually not possible for us to reach herd immunity. And I was wondering if y'all felt the same, and if so, why or why not?
Yeah, there's, I will tell you, with almost anything related to situations like this, there are varying opinions as to what's going to work and what's not going to work, and whether herd immunity is going to be effective or not. I think that the key is the number of people that we get vaccinated in our community. The more we vaccinate, the more we tamp down the virus. The more we tamp down the virus, the less likely it is to mutate. So there are any number of reasons for getting vaccinated, to protect yourself and to protect those around you that you care about. So, we'll see what happens with herd immunity and what percentage of our community is willing to be vaccinated. We know that 75 to 85% of our community does not get vaccinated every year for the flu. We would like to see that, but we know that that doesn't happen. So all we can do right now is continue to work to get the vaccine out and to get as many people vaccinated as we can, and watch what happens as we do that. I think a good indication of a small little experiment around herd immunity has been in our long-term care facilities. As more and more of them are getting vaccinated and the people that work there are getting vaccinated, we've seen our outbreaks drop from mid-60s in January. And I said outbreaks and clusters. We have 14 now in our community. So I think that's a good indication that the more people we get vaccinated, the less virus we have to worry about.
Next question is Brett Jensen, WBT Radio.
Hey, Gibby, Dr. Sullivan, I'm just curious, with your talks with Atrium and Novant and maybe the state, of the 1.1 million in Mecklenburg County, do we have a rough estimation of what percentage have gotten vaccinated, at least the first shot?
So the latest number for us, the partially vaccinated, it's 17% of our population. We haven't even gotten to 20% yet, so we've still got a long ways to go. Fully vaccinated is closer to 11%.
Next question is Chloe Leshner, WCNC.
Hi, everybody. Just wondering if you have an idea of when people can expect to go online and be able to easily book an appointment that maybe isn't super far out. When is that supply going to grow to enable you all to offer enough appointments?
That's the $1 million question. We know from week to week how much vaccine we're going to receive. We don't get much in the way of forecasting out beyond a week. So it's difficult for us to give you a specific answer there. We do know that the federal government is continuing to work with the manufacturers to get as much vaccine produced as possible, and then are pushing it down to the states as fast as they can, and then the states are pushing it down to the counties. So I think they're saying that by May 1, there should be enough vaccine out there for everyone, but then we know we have to get it in people's arms. So hopefully, at least by May, we're looking at fairly quick turnaround for people who want to have a vaccine.
And if I can just add one thing, I mentioned that, our hotline staff, again, is just working around the clock and has been reaching out to a lot of individuals on our wait list to offer appointments as they become available. And we have found that many of those individuals have actually already been vaccinated. And so we have to call several people to fill one appointment. And we're obviously willing to do it because we want every appointment filled. But I think that's a good sign that we are getting more and more vaccine into the county, and we are working really hard with our partners to make as many appointments available as possible, and we are seeing people able to make them, but we still, yes, fully recognize that the demand is still much higher than the supply, and we're optimistic that through April and into May, we'll start seeing a lot more appointment availability and a lot easier access.
And the other thing that I will mention, because I got asked this question a little bit earlier this week, is about people going out of the county because they can find vaccine in other counties surrounding us. We don't care where you get vaccinated. We just need you to get vaccinated. So if you are able to find vaccine in another county, we're not exactly sure why some of the smaller counties have more appointments available. Part of that may be lack of uptake in those communities. But if you can find it somewhere else and can get to it before you can find it here in Mecklenburg County, then by all means, don't hesitate.
Next question is Robin Kennedy, Fox 46.
Hey, good afternoon. This is Robin with Fox 46. Thanks for taking my question. This may be more of a state question, but I was wondering if you guys have any insight on how the folks who get their vaccines from Walgreens and CVS, are they counted in the Mecklenburg County count if they live in Mecklenburg County, or the state count, if they live elsewhere?
At this point in time, as we understand it, they are not included in the count. Those are federally provided vaccines that are federally provided to them directly. And if that's the case, then they report back into a federal system, not into the state system. So if we have folks that have gone to Greensboro to get vaccinated at the federal site that they have in Greensboro, or if they've gone to whether it's a Walgreens or a CVS that has received federal vaccine, we are not getting that data. So that's the good news. Then we've probably got more individuals in our community that are vaccinated than are being represented in the data at this point.
And I could just follow up real fast. Do you have any idea if that's going to catch up at some point, or those are going to merge, or any idea there?
We are having that conversation on a regular basis with the state and encouraging that to happen, because it's really hard for us to know what's going on and to plan in our community without full data. So we continue to encourage that and work with the state to figure out how we might be able to make that happen. So hopefully sometime in the fairly near future, those will come together and we'll have a full picture.
Next question is Hannah Smoot, Charlotte Observer.
Hey there, Gibby. I just wanted to clarify with you. So Mecklenburg County will be ready to open eligibility on track with the state's new timetable. Is that right? And when do you expect to see, that increase locally in vaccine supply? Is that, just by May, or do you have a specific time that you expect to see an increase?
So we will be opening appointments. I mean, the challenge is we're almost booked out we're booked out to March 31st. And as we have additional vaccine available, obviously we'll open more appointments as we go. And then we will start doing appointments on a weekly basis because that's going to help us with making sure that we're getting those folks who don't already have an appointment somewhere else. So we will as soon as we have more vaccine availability, we will be making sure that those appointments get put out there, and we'll make sure that y'all have that information. What we are hearing is continued potential increase in the state for vaccine. The state is expecting more the first week in April, the second week in April. So again, we don't know those numbers until Thursday evening for the next week. So we just have to sort of wait until we have a good idea each week before we can finalize appointments for the following week.
Next question is Dedrick Russell, WBTV.
Can you hear me?
Yes.
Thank you. Thanks for taking the question. I know our friends in South Carolina that they have reported that they've had problems with people returning for the second shot. And I just want to know, have you seen that in Mecklenburg County, or do you, people not returning for the second shot?
Yeah, I think it's a great question. And obviously anybody who is getting the 2-dose series, so Pfizer or Moderna, we really stressed during that first appointment that it is, we know that it is an incredibly safe and effective vaccine, but that data is based on the 2-dose series, and it's important for them to return for their second shot. What we are seeing is a pretty high return rate, but definitely not 100%. So not everyone is returning at their scheduled appointment. Some people do kind of reschedule and come back later, or maybe going elsewhere to get their second shot. We also, I think, have talked about this before for individuals who got their first shot somewhere and then either can't return there because they moved or are unable to get an appointment, and then may come somewhere else. And it becomes complicated because we're allocated second doses based on the first doses we administered, but we continue to work in special circumstances to vaccinate, again, as many people as possible with both first doses and second doses.
Thank you. And then a follow-up: is there a process, or has the problem gotten so out of hand that you have to do outreach, or have to do some more effort to track those people down, or it hasn't gotten to that level yet?
I think it's a question that we're constantly asking ourselves. I don't think it's gotten to that level yet. And again, I think especially with our community events, we see a very high return rate for those, or individuals who have contacted us to say they can't come back on that date, and then we work with them to make arrangements for another date. So again, I think we know that it's not 100%, but we're not quite at that level, but we're constantly watching that and are prepared to do that outreach if we need to.
Thank you.
Next question is Vanessa Rufus, WCNC.
Thank you for taking my follow-up. Sorry for the awfully specific question, but as you can imagine, we get all sorts of questions and viewers with interests in the different nuances of how the vaccines work. Is there anything that you could say as far as some of the research we're seeing surrounding the passage of vaccine antibodies now from mom to baby, whether it's during pregnancy or during breastfeeding?
It's a great question. I think that that's one where the data is still not, we just don't have strong enough data to make a definitive statement yet. I think we know that pregnant women and breastfeeding women can receive the vaccine. We know that pregnant women, there is research that shows that they are at higher risk of complications from COVID, and so definitely need to take extra precautions and should definitely have a conversation with their provider about receiving the vaccine. We also know that we feel very confident that the vaccine is unlikely to be in any way harmful or dangerous in breastfeeding. So I think all of those things are really good. That next question around if somebody has immunity, right, either through, or protection, I should say, either through infection or through the vaccine, is that passed on to the infant? And I think that's a question that they're still trying to do research on, but I expect to have more information coming.
Next question is Alison Kuznitz, Charlotte Observer.
Dr. Sullivan, can you provide an update on the homebound vaccination program? Has that started yet? How many people have signed up? And can you talk about, as your allocation increases and vaccine eligibility widens, how you think about how many people are on that list, as well as the equity plan?
Yeah, it's a great question. So we have continued to move forward with kind of finalizing the plans for the homebound vaccination. We have done outreach to a lot of those individuals. We are planning on kind of doing a very soft launch early next week, and over the next couple of weeks, and then really expect kind of that second or third week in April as we have a much more consistent supply of Johnson & Johnson to go further. I will say we have found something similar to what I talked about before, is individuals who have submitted a request for a homebound vaccine, and then when we call them to verify some details or to tell them about the timing, learn that they have already received a vaccine. So in terms of the number of requests, it's very fluid as well. I think we have received somewhere over 400 total requests, but some of those individuals, then we learn they actually managed to get vaccinated, and so we're still working through that process. But again, over the next 2 weeks, expect that soft launch, but really in April to see that coming. I think the numbers are going to depend on the requests and then depend on the supply. I do feel pretty confident, based on what we're hearing from the state, that we will have a steady enough supply of Johnson & Johnson by the kind of middle of April, that we should be able to factor that in on a regular basis, but I think we're still learning all of the details of that.
Floor is now open for follow-up questions.
Hey, this is Chloe with WCNC. Just wondering, as the entire population becomes eligible, are you all going to have plans to maybe open more clinics, or will you need more people to work at those clinics to kind of accommodate the larger population?
Well, as we've moved through this process, we've been considering what will happen when we have more vaccine and trying to plan for that. And part of that plan is potentially opening more clinics. But the other part of that plan is building the capacity out in the community, whether that's through doctor's offices or the traditional places where you get vaccine. The drugstores, the grocery stores, the doctor's offices, the places where you might go for a flu shot, rather than coming to the health department or to the hospital systems to get those. So we're working with all of those entities in our community to get them ready for additional vaccine. And the plan is, once we have more vaccine available, we're going to have a system in place where we can get that out as quickly as possible.
Guys, this is Brett again. Go ahead. Go ahead, Derek.
Okay, thank you. Just want to know, what conversations have you had with CMS as they have increased in-person learning? And also, I guess right now they have like around 60,000 students in the full remote academy, but some of those students can come back since schools are returning slowly back to normal. Just wanted to know, as kids go in the hallways, in the classrooms and things like that, what advice or conversations are you having with CMS so they can remain, safe and don't, lose sight of the goal?
We've been working with CMS from the beginning on their plans and meet with them fairly regularly to tweak their plans as their plans change, obviously. And they have specific plans about children moving from one part of the building to another, and specific plans about how they have lunch and how they get out for recess and those sorts of things. So they've got plans in place that they are implementing that we helped work with them on to make sure that they provided the safest possible environment for the children. As the number of children increases in the school setting, we know that our children can't be vaccinated at this point. So we're watching that very closely with them and continue to work with the school system. Meg, I don't know if there's something else you would like to add to that.
Nope, I think just as you said, I think ongoing conversation. We also know that the guidance, right, that we're hearing from the CDC as well as from the state continues to evolve. And so we are, yes, in constant communication as the guidance evolves. What does that look like on the ground level? And we provide all the support that we need to in order to make sure that as they continuing to implement kind of the current guidance and best practices that they have been doing.
Hey guys, it's Brett again. Curious. So I've been receiving the internal data from Atrium for about a year now. And whenever there was a rise or fall with the ICU numbers with COVID patients, it was always a gradual process. So I'm curious from your professional standpoint, when we hit in the middle of January, Atrium, more than 50% of their patients in ICU had COVID. In less than 6 weeks, that number went to less than 10%. I just got the latest data yesterday, and it's still less than 10% for all of Atrium. Did it catch you off guard, or were you both of you guys surprised at how quickly it dropped, where it wasn't a gradual process? I mean, it dropped dramatically once the vaccine started rolling out.
Well, and to be perfectly honest, I don't think the vaccine was really the cause for the dramatic drop. I do think that as they're vaccinating people as they come into the hospital, that may have contributed some, but we really did anticipate seeing a decrease at some level after the middle part of January, because we were getting past that holiday season when there was so much travel, people were in each other's homes, and that spike that happened actually not long after Halloween and through Thanksgiving and then through Christmas and New Year's, we expected to see the numbers come down. I will say that we're pleased at how quickly they came down, and we'll be pleased to see them stay down. Unfortunately, our hospitalizations are that lagging indicator. Right now, we're seeing an uptick in our other metrics. We're hoping that we don't see the same thing with our hospitalizations. And that's why we need to continue to be vigilant. We need to continue to do the things that protect us in our community, especially as we open up things more. Everybody just needs to be smart and use good common sense when they're out and about.
On that note, are there any concerns that, obviously we're going to have another layer of reopening happening in the state at 5 o'clock, that we're going to start to see even more erosion in that progress? And then kind of as a second part, since you did mention it earlier when we started to see this plateau, as far as the variants are concerned, how much of a growth have you seen of variant, present in the county? I know the surveillance is not all encompassing at this point. It's not very wide scale, but is there anything you can comment about that?
So every time there has been a change in the guidance that allows things to open up more, we are concerned. We watch it very closely to see what kind of impact that's going to have. The good news, I believe, one of the reasons we saw a significant decrease after January, people were more aware. We had put that sort of limited stay-at-home in place, and asked people just to be more conscious of what they were doing in the community and making sure that they were wearing their masks. And when our community does that, even when they're out more, we see improvements in our numbers. So my hope is that as we open up more, we want our community to continue to be able to stay open and continue to move in that direction. And the only way we're going to do that right now is if people continue to wear their masks, socially distance, and avoid large crowds. Those are things that we're still asking people to do even as things open up more, so that we can keep our numbers down where they are and watch them drop even lower as we get more people vaccinated. So I think there's a little bit of a concern, There's also concern we've got spring break coming up. And we know that lots of people have plans to travel and to be out and about. And I think, it's sort of a rite of passage for the spring, plus things are getting better with COVID, so everybody's feeling good. Let's go out and have a good time. We don't want to ask people not to have a good time. We don't want to ask people not to do the things with their family that they like to do over spring break. We're just asking people to be smart about it and to wear their mask and socially distance.
Can you address vaccination hesitation within the minority communities? How's that coming along?
So we've seen some slow increases in the percentages of individuals being vaccinated. Right now, we're right at 22% for African Americans and 6.5% for Hispanics. Those numbers have improved over the last couple of weeks, and part of that is because of the community events that are being done and increasing accessibility to those populations. I don't think we're going to have a real good picture of whether there is true hesitancy in those groups until we have more vaccine available in the community. So I think over the next month or so, we're really going to get a better picture of how much is lack of access and how much is true hesitancy.
And just a quick follow-up. I know that there was a push early on. Is that push still being consistent? Because I heard that there may be billboards and, in Spanish talking about getting the message out. So I just want to know, is the foot still to the metal, or have you eased up a little bit on that?
Oh, no. I've been accused of having a lead foot, and it still is still working right now. There has been a countywide effort working with some vendors in the community. There is a new campaign, Count on Me, in Mecklenburg that is rolling out, that will include those billboards you're talking about. It will include TV ads. It will include radio. But it's also going to include church bulletins. It's going to include information being dropped off door to door in certain populations, certain communities. So, and a lot of social media. So there's a lot of moving parts to this particular campaign, and it is just kicking off. So we want to make sure that everybody has the information they need so they can make good choices, and also that they know the importance of protecting themselves and protecting others, and where they can access vaccines. So there's a lot of work happening in that area, in addition to all the additional clinics that the health department and both hospital systems are providing in some of those communities to make sure we're making the vaccine we do have accessible. So lots of effort, and hopefully you'll be seeing even more of that over the next couple of weeks.
Thank you.
You're welcome.
Next question, please.
Go back to last, I had a two-parter the last time.
I left out the second part.
Variants, if you had anything you could, I know surveillance is not that great, like it's not like we're testing every single sample that comes in, but you've seen an increase in Mecklenburg of the variants, and are you quantifying?
Yeah, that's a great question, and unfortunately, there's not enough surveillance testing going on in our community right now to give you a good solid answer. We do know we have variants of that here in the county. We've seen the variant from the UK. We've seen the variant from California. We've seen a number of the variants here, and if you've got one or two cases, you have more. So we know that it's out there. We just don't know the level. There's continued ongoing conversations about more screening and surveillance to really try to figure that out better, working with the state on that and some other partners, but we just don't have that information right now at that level.
Hey guys, it's Fred again. I wanted to go back to Derek's question where he was talking about the minorities and trying to reach out to them. And in a weird way, one of the things that also sticks out of those reluctant to get vaccinated, oddly enough, are white males, and particularly white males that live in rural communities. And I know we don't have many rural communities in Mecklenburg County, but are you guys seeing that here in Mecklenburg County as well, where specifically white males are reluctant to get the shot, and maybe their numbers are down comparatively speaking to females?
In general, we are seeing a little bit higher percentage of females being vaccinated to males. If you look at the data, the numbers in the 20 to 35 range that percentage is a little bit higher than the other age groups, which is good. And the problem we get into is the demographic data we have on vaccine right now for the county comes from the state system, and we haven't been able to drill into that. We just have to take what they give us. We're advocating to actually receive the data so that we can do more analysis, but we just don't have that available to us at this point. We're always concerned about every population, and so I was talking about some of the things that you'll see from this campaign, which will include some support from individuals from NASCAR, and I mean we're trying to reach all populations. So we'll stay on top of that one, Brett, and continue to try to analyze as the data becomes more available to us. We will focus on any population that's underrepresented.
Do you anticipate? I'm sorry, just real quick follow-up. Do you anticipate the state giving you any of that data?
We have asked for it so that we can better analyze. We appreciate what they've been able to give us, but it's just not at the level of detail we would like to see it. We can't look at it very, very much from the zip code perspective. There's just a number of things that we've not been able to do because we don't actually have the data. So we're advocating for it. Fingers crossed.
Gibby, beyond screening for the variants, can you talk about what's being done to maybe just increase testing all around, that our testing numbers have remained pretty steady over the past month?
Well, testing continues to be an important part of the whole response to COVID. We need to continue to make sure that people who have potentially been exposed or who definitely have been exposed to somebody who is positive, and also anybody that has symptoms, we are making sure that testing is readily available. It's free of charge. People do not have to pay for testing. Turnaround on testing is very low. It takes sometimes less than half a day to get your test results back. So we are continuing to encourage people to be tested if they've been in a large gathering with a lot of other people, especially if folks aren't socially distancing and not wearing masks. If you're traveling and you haven't been vaccinated, you should consider getting tested before you go and when you come back to make sure that you've not been exposed. And there are even some places that if you don't get tested before you go, they're going to require you to quarantine when you get there. So you need to check on all of those things. But the testing's available, and it is a critical part of getting this virus under control. So we encourage people to continue to take advantage of that.
Next question, please. Any follow-up questions? Thank you, everyone. Have a great afternoon.
Thank you.